Hello, I'm Pamela Meriwether. I'm a certified yoga teacher with the Yoga Alliance, as well as yoga for cancer patients. Receiving a cancer diagnosis can feel somewhat like falling off a cliff, very disorienting and terrifying and painful. Yoga can provide a method for finding your footing again and coming to solid ground. While yoga is not a cure for cancer, it provides a complementary therapy that can truly assist you in your journey on the healing path. There are trained medical professionals that do best with assisting the healing process of the more serious aspects that are physically related to cancer. Yoga, however, can also benefit you physically, making you feel stronger, more flexible, and more at ease in the midst of chaos. But the benefits of yoga extend well beyond the physical realm. In fact, I would say that the most positive effects of yoga are on the well-being of our mental, emotional, energetic, and spiritual well-being. Yoga can restore that sense of peace that a cancer diagnosis can diminish or even destroy. But there are two things that yoga and cancer have in common, and that's they can both be mysterious. I would like to demystify some of the yoga side of things for you in hopes of giving you real tangible tools that you can begin your own yoga practice to support you in your healing process. There are many different techniques that fall within the yoga umbrella. Most of them are geared toward helping some part of our immune system, whether it be the digestive system, the lymphatic system, respiratory and circulatory, and endocrine. All of the yoga techniques are helpful in some way or another. I would like to share with you some of those techniques that I find most uniquely helpful in stimulating the parasympathetic side of the nervous system. This is the part of the nervous system that's responsible for keeping us more peaceful and calm on the inside. And pranayama, which is mindful breathing, is my favorite, and in fact, one of the most beneficial of all the yoga tools. There are two different ways that we can use breath work to help bring more of a sense of calm to us and stimulate this parasympathetic side of the nervous system. One of those is diaphragmatic breathing. And that means we're really getting deep into the torso when we breathe, releasing the diaphragm muscles that are beneath the lungs. So you may find that if you start to notice where you breathe, most of it occurs up in the chest or even just in the front of the body. Let's explore for a minute what diaphragmatic breathing is like. Just bring your hand to the lower part of your abdomen. I suggest placing your thumb right on your navel. And then take a look down at your hand while you're breathing through your nose. Ideally, the hand moves outward as the breath comes into the body, like a balloon expanding when you breathe into it. And as you exhale, the hand goes back in. Just stopping and bringing the breath into this lower part of the belly can really bring you a sense of calm. Be very helpful in trying moments when you may be nervous or anxious. Another technique in breathing that can help reduce stress and anxiety is lengthening the exhalations. So once you become comfortable with bringing the breath into the belly, then you can begin to lengthen the exhale, maybe even twice as long as your inhalation, to accentuate those benefits. The main thing is to remain calm and at ease as you're practicing. Meditation is the second technique I'd like to share with you. It has been well documented that meditation brings more of a sense of peace and ease to our perspective and to our overall well-being. It's being studied widely in the Western world now about the benefits both physically and mentally that meditation can bring. I hear students all the time say, well, I can't meditate. I'm too busy. I can't sit still, or my mind won't be calm. Please understand that you're not alone if you feel that way. Everyone's mind is busy. It's the true nature of the mind. It wants to be busy. But everyone can start to practice stillness just by taking small steps. Sitting for just a minute each morning before you brush your teeth or get ready for your day is a great way to start. What I recommend is sitting in a quiet place and just focusing on your breath. Either closing your eyes or looking at a candle are two great techniques. But it's just like brushing your teeth. Eventually, you understand that the benefits of meditation come from daily, consistent practice. And then your perspective will begin to change, and this new sense of ease can come back into your life. Last, but certainly not least, are the asanas. These are the yoga poses that we do when we practice yoga. They are very helpful both for the immune system and the mental state because we're actually moving energy through the body and mind as we practice. But there are as many different ways to practice yoga as there are people. And not just any yoga class is really suitable for someone that's going through the cancer process. Depending on where you are in your stage of disease, where you are in your treatment, be it surgery or chemotherapy or radiation, the type of practice that you do needs to be adjusted so that it's supportive to where you are. I highly recommend that you find a class led by a teacher that's certified in working with people who have cancer. And if you can't find a class dedicated to that, look for a restorative class or look for a teacher that can individually work with you who's been trained in the cancer process. Finally, I want to share a Sanskrit word with you called namaste. Namaste is what we often hear said at the end of a yoga practice. And essentially what it means is the light and good in me sees and appreciates the light and good in you. I wish you all the best. May you be guided by your own light. Namaste.